So thanks very much for the opportunity to discuss our study today. I guess by way of background, triplet regimens basically harness three distinct mechanisms of action to effectively target CLL cells, and they combine a BTK inhibitor, a BCL2 inhibitor, and an anti-CD20 antibody. And preclinical studies had demonstrated that BTK inhibition increases the functional dependence on BCL2. And also specifically the Elevate-TN trial had demonstrated that combining the BTK inhibitor acalabrutinib with obinutuzumab achieved increased efficacy compared to acalabrutinib alone. Now, the first novel triplet agent regimen to be investigated in CLL was ibrutinib in combination with venetoclax and obinutuzumab. And while that triplet is highly active, in those studies, characteristic toxicities of ibrutinib were seen. And so we and others have investigated employing better tolerated BTK inhibitor like acalabrutinib or zanubrutinib in combination with venetoclax and obinutuzumab. And that was in part the rationale for this phase 2 study. So as you're alluding to, this phase 2 study was initially designed with an all-comer cohort, which enrolled 37 patients regardless of TP53 status. And we subsequently opened an expansion cohort in patients restricted to high-risk disease, so specifically those with TP53 aberrant disease. And we have 31 of those patients included in the updated results that we're presenting at ASH this year. In our subgroup analyses, we see similarly high rates of complete response by IWCLL criteria, as well as undetectable MRD in both the peripheral blood and the bone marrow, regardless of TP53 status. Absolutely. So overall, we've found that the triplet AVO, so acalabrutinib in combination with venetoclax and obinutuzumab, was highly active and well tolerated. So in total, 43% of patients achieved the primary endpoint of the study, which was a complete response with undetectable MRD in the bone marrow. And in addition, at a median follow-up of just under 3 years, we saw relatively low rates of both infectious and cardiac toxicities. And importantly, we saw that this triplet with a time-limited MRD-driven duration is highly active in patients with TP53 aberrant disease. Well, we are very excited to continue to see the clinical outcomes for the patients that are still receiving treatment as part of this study. And in addition, these results will provide an important foundation in investigating this triplet, specifically in patients with high-risk disease. As you may know, there is an ongoing phase 3 study investigating the AVO triplet in non-high-risk CLL patients. And so our study will provide additional important data on this triplet, specifically in those patients with TP53 aberrant disease. I guess just other points to highlight in terms of the really promising clinical outcomes we've seen thus far is that at this updated data set at ASH, at a median follow-up of just under 3 years, the progression-free survival rate in the entire population is 93%, which is quite high and very encouraging.